New virus outbreak of human metapneumovirus in China 5 years after COVID-19, emergency declared. China is grappling with a health crisis as human metapneumovirus, hMPV, rapidly spreads across northern provinces, particularly affecting children under 14. Reports suggest hospitals and crematories are overwhelmed, while health officials warn against the misuse of antiviral drugs. With a rise in multiple respiratory illnesses, including influenza A and Mycoplasma pneumoniae, authorities have declared a state of emergency and launched a pilot monitoring system to manage the surge in pneumonia cases and other acute respiratory diseases this winter. China is grappling with a surge of respiratory illnesses, notably human metapneumovirus as winter sets in. The outbreak comes 5 years after the outbreak of the deadly COVID-19 pandemic, with various reports suggesting that hospitals and crematories are struggling to cope with the rising number of cases. Social media posts and online videos depict overcrowded hospitals, while some users claim that multiple viruses, including hMPV, influenza A, Mycoplasma pneumoniae, and even COVID-19, are circulating simultaneously. In fact, while the flu and hMPV are contributing to respiratory infections, influenza A remains the leading cause of illness this winter. Yes, there are more cases of hMPV, but this is still a localized issue, and there's no sign it's reaching pandemic levels. It's also important to remember that hMPV isn't new. It was first identified in 2001 and typically causes seasonal outbreaks, reports TOI. It is most likely to spread from an infected person to others through secretions from coughing and sneezing, close personal contact, like touching or shaking hands, touching objects or surfaces that have the viruses on them, then touching the mouth, nose, or eyes. According to the CDC, hMPV circulates in distinct annual seasons, and circulation begins in winter and lasts until or through spring. Human metapneumovirus, hMPV, is a respiratory virus that causes mild infections similar to that caused by a common cold. Children, the elderly and those with weakened immune systems are more susceptible to contracting it.